It is a pleasure that you are with me again. I hope you and your pet are well. Today we will talk about the following: lumps on dogs and when you should be concerned. Let's start. Finding a new lump on your dog can be alarming and worrying about everything. Some dogs just seem to develop masses over and over again, while such a finding is unusual in others. So at what point should you worry? There are a number of things you should consider. 1. When are lumps on your dog dangerous? There are no strict rules for what constitutes a worrisome lump. Many tumors, including mast cell tumors and melanomas, are called great mimics because they can look and feel like anything. Even a lesion that looks like a scab or patch on the skin may actually be a tumor. It's also true that many dogs will develop benign fat-based masses, called lipomas, as they age. This is in contrast to people, who usually have some sort of metabolic disorder when they develop such masses. 2. Examination and monitoring of lumps in dogs. It is important that you discuss the behavior of the mass with your veterinarian. You should ask yourself, has the lump become red or ulcerated, causing it to bleed? Has the mass increased or decreased in size, or even disappeared? Has the mass increased in size and, if so, by how much and over what period of time? These are all very important questions that can help a veterinarian decide if the mass is more of a concern and should be sampled. Any new or changing lump, large or small, should be examined and possibly resampled. Masses can also change over time. A mass that may have been a lipoma years ago could manifest as a new tumor over time. Any change is important and you should contact your veterinarian. Along with your vet, keep a body map to track masses. A body map is a sheet of paper or digital file that has each mass labeled, measured, and updated on a routine basis. This helps ensure that all masses are properly served. 3. What about lumps in cats? Cats, unlike dogs, don't seem to develop masses as often. A new mass in a cat, especially on the skin or in areas where previous injections have been given, is worrisome and may be a cancerous-type lesion. If any injury is noted, you should have your vet investigate. 4. Diagnosis and treatment. Depending on the location of the mass, size, and other possible factors, a multitude of tests can be performed. In general, the main and less invasive diagnosis is a fine needle aspiration and cytology. This involves putting a needle into the mass and spreading the collected cells onto a slide for review by a pathologist. If you think of a brick wall, it's like taking individual bricks out of the wall. Depending on the results of the cytology, the veterinarian may order some form of biopsy. This is more invasive and usually involves taking a small piece of tissue from inside the mass and sending it in for review. Going back to our brick wall analogy, this would essentially be testing every brick in the entire wall, and can help with a more definitive diagnosis. If a diagnosis of cancer is made, your vet will run further tests to make sure it hasn't spread elsewhere, such as blood tests, chest x-rays, or an ultrasound of the abdomen. Definitely. If you notice a new lump that is growing or has changed in size or consistency, be sure to see your vet. When the masses are small, they are the easiest to remove, and early detection leads to higher control rates. Develop your dog's hidden intelligence to eliminate misbehavior and create the well-behaved, obedient pet of your dreams. Hit the instant access button below now. Don't forget to subscribe to the channel, comment, and share the video. Thanks.